Welcome everyone for the bulletin brief for this week. We're honored to have Dr. Meghna Kashyap, who is a third-year resident at the University of Nebraska in Omaha, Nebraska, who's going to be speaking to her about her article in the January edition of the Bulletin of the American College of Surgeons entitled, intriguingly, Mirror, Mirror, How Current Societal Issues Reflect Changes Arising in Surgery. Dr. Kashyap, thank you very much for joining us today.
Thanks for having me.
The article was incredibly interesting, really, in particular, how you and your authors really interwove some major societal trends and really hashtags, really, that have really helped to highlight issues that have been important in our society. And then you really brought those back to issues relevant in surgery as well. Could you speak a little bit about how you came up with this idea and how you developed it?
Yeah, so first of all, we really appreciate the bulletin letting the RAS take over the issue. And, we come up with the topics, and each committee comes up with, their take on whatever overriding theme that we've come up with. Each year it's well researched and well thought out. And I just thought, rather than just kind of a straight scientific sort of analysis of the theme, why don't we tie things into what's happening in current day society? There's a lot of surgeons and, med Twitter is a big thing. And so I thought, why don't we tie in these hashtags and bring some relevance to issues that are currently happening every day in the news, and make what's happening in surgery seem like it's not just in surgery, and that maybe the solutions don't have to be found just in surgery or in medicine. We can look at solutions elsewhere as well.
I think it's a really great take because I think there's a lot of work done, not just in surgery, and there is a tremendous amount of work done in this area in surgery, but throughout society as well, as we recognize some of these issues being so important. Let's kind of work through some of these hashtags that I found. The first one to be very intriguing is Lady Gaga's hashtag, I believe, Born This Way.
Mhm.
Tell us about that.
I actually found it quite tough to figure out what is the best hashtag to use for LGBTQ plus, and I think that's actually representative of what's happening. I think that we know about issues with racial disparities and like social determinants of health when it comes to race. And similarly, we know about gender disparities and pay gaps and things like that. However, I think we do lag behind both in society and in medicine, especially in our care of, our knowledge of LGBTQ plus patients, and having colleagues also in that community. And similarly, looking on Twitter hashtags, nothing's really blown up. And Born This Way was the closest thing to what would be a trigger hashtag that everyone would say, oh, yeah, I know that's a Lady Gaga song. I know that's associated with the LGBTQ community. So that's why I chose it. And that first section talking about it is, I think the least robust of our entire article. And I think it's very telling of the kind of lack of progress that we've made in that avenue.
Could you speak to more on where you would have hoped we would have made more progress during this time period, and what you think would help for us to make more progress like we have in other areas of disparity?
I think that there's a lot of people studying health disparities, and I just think that maybe right now it's kind of a newer topic of research. So as we were looking through and kind of figuring out, what are big major like landmark issues that have been dealt with in society. There's a lot going on with the LGBTQ plus community, but like the Oscars So White or the Black Lives Matter or the I Look Like a Surgeon, there's nothing that's really been out there and like for a prolonged period of time, a sustained movement for them. Aside from, we all know that like Pride Month happens, the gay pride parades, things like that, but I feel like there's nothing just kind of socially relevant that sticks for that. And in surgery, again, like I don't think research yet is well developed. I think it's kind of nascent as far as studying, transgendered patients and the care of them, we're slowly starting to learn that, there's the psychosocial approaches, there's different considerations in transgendered patients. We do know in like infectious diseases, but I think in surgery, we don't necessarily talk about all the time that there may be differences in the care given or the care needed for the LGBTQ plus community.
You already kind of touched on one of the other hashtags, which is really having to do with the Academy Awards. I actually wasn't aware of that hashtag before. Could you speak a little bit to how that hashtag was created and kind of how that would also influence how we look as a surgical community?
Yeah, so it's all about representation. So the Oscars So White started, we people were noticing that during various awards ceremonies, but especially the Academy Awards, the winners and the nominees were generally white, Caucasian people. They were generally, like a lot of males, a lot of stereotypical, just white Caucasian males, and noticing that there was a lack of diversity. But it went further than noticing the nominees and the winners to identify that the actors, there's not a lot of representation on screen for not just African Americans, not just Hispanics, but Asian Americans, Native Americans. There's just the entire diverse diaspora of America is not represented on screen all the time. And then people looked into it further, and it's one of our graphs where directors in Hollywood are also not diverse. Some of the people working on sets, just representation matters. And I think we've been finding the same thing in our surgical communities, our medical communities, where who's sitting at the table at the higher level, who is on the boards, who are the chairs, who are like the division chiefs. Who are we promoting, and are we not realizing implicit biases against diverse individuals and promoting them, or realizing their circumstances and maybe their need for some extra attention to promote people in order to show that there's leadership in the Black community within medicine, so that more medical students from the Black community join and we increase that diversity pipeline.
The analogy that you make is really a key one about making sure that individuals that make decisions are from communities where they would think of other individuals that may be more representative of American society as well. And I think that goes to be the same in surgery as well. And a hashtag that I'm more familiar with, and perhaps one that many have heard of, is really from that New Yorker, I believe it was a New Yorker article. I look like a surgeon, where I guess there were four women, I guess, around an operating room table. Could you speak about that movement? And I would say that was boy, I saw that hashtag quite frequently, and I'd still actually see it around, not infrequently.
Yeah, so I think one of the people who started the hashtag on Twitter, I look like a surgeon, was actually one of our RAS members, and it was something that I don't think they knew that it was going to blow up the way it did. And then the subsequent New Yorker cover photo, just showing that women are surgeons. I think everyone is more and more aware each day that often women physicians are not necessarily recognized, as far as patients or colleagues mistaking them as other healthcare workers or whatever it may be. And so I think it was a very important societal hashtag for people, not just in the medical community, but in the public at large, to realize that your doctor may be a woman, and in fact your surgeon may be a woman, and women can do all of these professions that you see men doing. And so it was really nice to see that this wasn't just in the surgical community. It was a hashtag that just went pretty much global.
In that section, you also discussed in some detail about pay gaps. You mentioned, for example, the U.S. women's soccer team as an example of that pay gap that exists with the men's soccer team. Could you elaborate on that and how that is also an issue within the surgical world?
Looking at the average salaries of department chairs, there's this is published data that women chairs in surgery are often paid less. Their average salary is less than their male counterparts, and we find this in every profession. I think recently what I had recognized was that the WNBA and then the U.S. women's soccer team both had been in kind of public battles for pay equity. I realize that there's more nuanced discussion about women's sports and versus, like women in surgery. But I think the point is just the same, that for some reason women are paid less, and there's various reasons. There's a multitude of reasons. It could be because of how we negotiate or what have you, but ultimately recognition from all parties that there is a pay gap and we need to address it, whether it is with women and learning negotiation skills, or recognition implicit biases against women who are negotiating the way men are, and appreciating that there's similarities there, but then there's biases against how that's perceived by others. There's some work to be done, and it's kind of the same conversation when we talk about women's sports and those pay gaps and any other profession.
Sure, and I think an incredibly important topic. And you kind of alluded to the fact that there's going to be a lot of nuance there as well. And as you know, the U.S. Women's soccer team had a fairly strong and very public campaign to address the pay gap. What would you suggest as an effective strategy to try to reduce the pay gap, or eliminate, ideally, the pay gap that exists within medicine and surgery specifically?
In a simplistic world, I would say that everyone, meaning both men and women and any gender, be educated in what the problem is, which is the pay gap, and then what has led to it. I actually learned this from the Association for Women Surgeons at one of the annual meetings a couple of years ago, where this topic was brought up, and they had someone come in to talk about negotiation skills, which is why I brought that up. That there is a difference in how women negotiate versus how men negotiate. And some of that is due to how men or women both perceive women when they are more tough negotiators. We always hear terms like aggressive, assertive, the B word, used for women who are acting the same way as a confident man. It's all about implicit bias training and recognizing that these things happen. And that's where simplistically educate everyone so that they recognize it, and then we can address the problem. But implicit bias is so difficult to tackle, as we've been realizing as more and more people are doing implicit bias research and trying to figure out ways that we can solve this problem.
I think that you hit the nail on the head there. Trying to address really the underlying implicit bias would be the ultimate solution. But you're right, that is a tough nut to crack for sure, and a very slow process. Well, I really, again, enjoy the article. Is there anything else that you'd like to point out in the article that we didn't cover?
I think the only thing is intersectionality. I think that, we presented three categories of people, but, every individual has a different background, and just appreciating that, while sometimes stereotypes may be right and sometimes they do actually help in guiding you in decision making or whatever it is, at the end of the day, you're speaking to an individual, and recognize them as, I am a minority woman, so I am part of two categories within our article. But there's people who cross all three of the categories or none, and they have their own categories. We mentioned the elderly. We mentioned, there's other groups of people who are also sometimes neglected, and we just need to recognize that everyone is diverse, and we need to appreciate the diversity and try to lift them up, lift everyone up.
Well, Dr. Kashyap, thank you very much for taking time out of your day to discuss this article with us. Again, it was a really great article in the sense that it really brought some major societal trends to the fore and really helped to understand them within the context of the surgical world as well. So thank you again for your time.
Thanks for having me, and thank you to the Bulletin for publishing it.